Hello, and welcome to Medicine Made Easy. So before we sort of jump into what strokes are, let me sort of just orient you to what we're looking at here. So this is a side view of a person, and we can see the contents of their skull. Let's do some labeling here. So we've got the skull here, and obviously the skull protects the brain. We have the cerebrum, the most obvious part of the brain, in pink. We have the cerebellum down here, and we have the brainstem. Now in terms of vessels, blood vessels, all the blue that you see here, these are all veins. These are the veins that drain the brain. And now let's label some arteries. So here in front, we have the internal carotid artery. And remember, we are only looking at the left side here, so we can only see the left one. And here, sort of running up the inside of the vertebrae, we have the vertebral artery. Now it gets a little bit tricky here. This is the basilar artery. Here is the middle cerebral artery. I'll call it the MCA. Here we have the posterior cerebral artery, the PCA. And in front here we have the ACA, the anterior cerebral artery. And you can sort of see the circle of Willis forming right here. Alright, so let's jump into it. All those vessels supply blood to your brain. And if you lose some or all of the blood supply, then you lose some or all of your brain function. So the loss of some blood supply causing the loss of brain function, that is a stroke. So there's two main ways to disturb this blood supply. The most common type of disturbance is where you get stoppage of blood flow to part of your brain. Let me draw this out for you. Let's say this bit of the ACA is blocked off. This means that blood won't be able to go to this previous part of the ACA over to the next part of the ACA. And if blood can't get through, then the brain tissue downstream that depends on that blood for its oxygen, that brain tissue would then start to get injured and start to die off. Now the second kind of disturbance is not as common but still really serious, is where one of the blood supplies to your cerebral circulation, the vessel, ruptures. Let's say that this bit of ACA right at the junction between the ACA and the anterior communicating artery starts to balloon out, right? It starts to form an aneurysm. Well, eventually that aneurysm could rupture. Out of your cerebral circulation comes the blood leaking and into the space around your brain. So if that happens, there's two major consequences. First, because you're leaking blood out of the cerebral circulation, these downstream parts of, say, your anterior cerebral artery here obviously won't be getting any blood. So again, this downstream brain tissue is going to have a lack of oxygen around, so it'll start to get damaged. Also, the blood will start to collect and sort of push on your brain tissue and cause damage to your brain that way. So those are really the two types of stroke. You can get stoppage of blood flow to an area called an ischemic stroke. Ischemic referring to the cellular environment where there's not enough oxygen. Or you can get a rupture of vessel like we saw earlier, and this is called hemorrhagic stroke. Hemorrhagic refers to a sudden torrential bleeding outburst. So, ischemic stroke and hemorrhagic stroke. But regardless of whether you have an ischemic stroke or a hemorrhagic stroke, either way, your brain cells are going to start to malfunction about 3 minutes or so. That's because there's now a lack of oxygen, right? Because you don't get a proper blood flow, not getting a proper blood supply, and they're not getting enough glucose. And they need their glucose in the bloodstream to function properly, to carry out the complicated functions. So what do you think might happen if part of your brain or just sort of stop working, start to malfunction? Well, intuitively you might start to think, hey, well, if part of my brain starts to malfunction, I might lose those abilities that part of the brain performs, right? So let's look at a few examples here. let's say we get a clot. This is a clot here. Let's say we get one in the middle cerebral artery. That means blood is not going to be able to get through the MCA, right? Here's blood in the MCA. All of a sudden, we're going to lose the abilities that the downstream part of the brain perform, at least temporarily. Now, the middle cerebral artery is pretty important. It actually supplies blood to two really important parts of the brain. One's called the Broca's area on the outer part of the brain, and one's called the Wernicke's area. And these two areas are really important in determining your speech, determining how you speak, or whether or not you can understand what people are saying to you. So if you get a big clot in your middle cerebral artery, and you happen to stop blood supply to Broca's area and or Wernicke's area, you're gonna end up with problems with your speech. Now let's do another example. Let's say you get a clot here, in this little artery coming off the basilar artery. So that runs up your brainstem, and there's a lot of special nerves called the cranial nerves that originate on your brainstem and sort of go their separate ways from there. Now some of them are involved in controlling your facial muscles, and these neurons lose oxygen. It means you might start to have the edges of your mouth droop. It means your eyelids might start to droop. Basically, you might not be able to use some of the muscles of your face. So what exactly determines how bad a stroke is? Well, two things. Where in the brain it happens and how much brain tissue is actually damaged. And what determines that? Well, it's determined by which blood vessels are involved. Now, if you get a big clot right about here, then you're not going to allow blood to your brainstem. So your brainstem will start to die off, and that would be really bad, because your brainstem is really responsible for keeping you alive. It has all the regulatory centers that controls your breathing and your heart and a lot of other vital functions. In contrast, if you get a clot, let's say in this tiny vessel here, or this tiny vessel right about there, or in this one here, then how much brain injury would you end up with? Well, you end up with a little in each small area, and while ideally you don't have any brain injury, the sort of functionality disability that you suffer if you had these small strokes compared to this really big and significant stroke, that'd be a pretty big difference there. So just to reiterate, the severity of the stroke depends on where you get your stroke, and if you don't want to have it in your brainstem, and how much brain area is involved. And is this brain injury reversible? Well, most of the time, yes. Neurons start to die about 4 minutes without oxygen. So what would cause a stroke to happen? Well, it's common heart conditions like atrial fibrillation, where the uppermost chambers of your heart don't contract properly. That often creates blood clots. And then these blood clots, you get pumps into your heart, they can travel into your brain and get stuck into the brain blood vessels like we saw earlier. Another common heart-related cause is myocardial infarction or heart attack. And when you have a heart attack, a part of your heart wall might start to contract not properly, and when that happens, small blood clots can grow on the heart walls and be pumped out into the brain. Another really common cause actually is when you get something called atherosclerosis, or a build-up of sort of this fatty cholesterol plaque in the walls of your arteries. So let's say that you got some cholesterol building up in the walls of the artery here, in the internal carotid. Well, as you can imagine, blood is going to have a really hard time getting past this sort of massive cholesterol that's stuck in the wall of the artery, right? And this can happen in multiple places in the brain too. And if you actually have one, you're likely to have another. So you might have one there, and you might have one, say, here. You might have one there. So they are really dangerous, atherosclerotic plaques. Now let me switch gears for a second and talk about something called TIA, or transient ischemic stroke, also known as a mini stroke. It is essentially a temporary interruption to blood supply in the brain. So the symptoms of the TIA and stroke, they're really similar. But the difference is that TIA doesn't actually destroy the brain cells, so it doesn't cause permanent disability. So one of the key differences is that the TIA will resolve. It will kind of go away within 24 hours. Well, if you have a stroke, then if you have a proper stroke, you may not gain normal function for weeks and months, or maybe even the rest of your life. So let me quickly show you what this would look like. In a proper stroke, let's say this vessel gets blocked. Without treatment, this tissue will die off. But in TIA, you get a little clot. This area will start to become injured, and then the clot would spontaneously break up or go away, and then all of a sudden this brain tissue will start to go back to normal again. And so in the vast majority of situations, you won't be left with any permanent brain cell death. So to finish off, let's just clear up a few misconceptions about stroke. So there's a common thought, that strokes are primarily heart related, and as we saw earlier, the heart's certainly involved in some causes of stroke, but strictly speaking, strokes are conditions related to the mismatch between cerebral blood flow supply and the demand. So it's a brain problem. There's another common misconception, that strokes only occur in the elderly. And while this is true, about 2/3 of stroke happen in the elderly, people older than 65, a pretty significant 1/3 also happen in people under 65. So it does happen in people of varying ages. Lastly, and most probably the most important, strokes are not unpreventable. There's a lot of things you can do to reduce your risk of having a stroke, such as controlling any high blood pressure or stopping smoking. Thank you for listening. If you like this video, please give a thumbs up. If you have any comments or requests for future topics, please drop a comment below or complete the survey in the description. Cheers!